Nigeria in some or continue to hear. It may pass 5 p.m. on the 7th day of the 8th month in 2025. A Thursday it still is, if you need a reminder. And speaking about reminders, it's been 4 years since the 132-bed space Mother and Child Hospital in Port Harcourt was built and commissioned, but it remains closed and has never been used. Also, the 25.9 billion Naira Dr. Peter Aldele Cancer and Cardiovascular Disease Diagnostic and Treatment Center is yet to be in use about 3 years after it was built and commissioned. Describing the continued closure of the two hospitals as a symbol of failed expectations, a medical expert, Dr. Tamunokuro, tells correspondent Martha Okere that both health facilities were targeted at tackling key healthcare challenges and improving the country's performance in maternal health indicators. He said if the facilities were operational, it would have helped reduce the pressure on existing hospitals, attracted skilled medical professionals, and slow down the brain drain affecting the health sector.
As it is now, people will still be going outside the country for services that they could have obtained in this place. And then the brain drain that would have been arrested, because for that place to be up and running, that would have attracted the best of the best from all over the world to come and work in River State. But as it is now, the hope seems to have been dashed. Rather, it seems that they have just built a health center for rats and cockroaches.
Okoro says the continued delay reflects a form of bad politics, saying it is unusual for a project to be commissioned without being put to use. He said, however, that despite the disappointment, the government still has a chance to act by making the facility fully functional. The chairman of the Nigerian Medical Association in the state, Dr. Tamunokuro, also spoke on this.
These two facilities have been equipped to world-class standard, but continues to be a symbol of waste and a reminder of our collective inefficiencies if they are not put to use. The possible employment opportunities, the services to be rendered and received, the income to be generated, as well as the knowledge to be gained by health workers all remain a mirage to our dear state by the persistent closure of these health facilities. The best time to have acted was yesterday. The next best time is now.
Well, the man who's telling us about the best time is right here with me. He's Dr. Tamunokuro, the chairman of the NMA, Nigerian Medical Association, River State Chapter. Good day, Dr. Diamond.
Thank you, sir. Good evening to our listeners.
Thank you for joining us. How are you doing, sir?
Great.
Fashion-wise, you don't look like a doctor.
Well.
Because I remember last time you were in a suit, right? So it wasn't really difficult to imagine that.
That's right.
But this time you look very Nigerian.
Annual general meeting is on. They're having outreaches to indigent river citizens so they can have access healthcare. So that's why I'm the way I am. Okay,
so before we get into this, they say a doctor is always on call. Is it always on call or always? That's how the expression goes.
Yeah, should always ready to deliver service.
Okay. While that is the case, because, of course, it's an essential service, are there times where you would like not to be ready to deliver, where you really just want your own time and say, listen,
absolutely,
I don't want to be a doctor right now?
It's the dilemma of the medical doctor. You know, you would want some time to be with family, to be alone, to be on vacation. But, I mean, in a country where you have one doctor attending to over 10,000 patients, when it's supposed to be one doctor to 600, you realize the Nigerian doctor has no free time to himself, really.
Okay. So let's look at when you actually do have free time, right? Let's imagine that you're on vacation with maybe family to another country and you're just relaxing. And there's a medical emergency, somebody is choking or there's something. Do you feel the need to act because you are a doctor? Or do you look at, okay, jurisdiction, this is not my country, I don't know how what's the first instinct that kicks in?
You don't only feel the need, you feel the impulse, and you wouldn't know when you start acting, because you feel that you need to save a life and there's a life to be saved. So you just jump on it, and sometimes it's when you're done, you realize, oh my God, I'm not licensed to practice here, but you saved the life,
Okay, hopefully you save that life, because if you don't, what are they? Okay, so let's look at the facilities in question, and these are case studies, because I'm sure there are many others. Walk us through the importance of the Mother and Child Hospital and the Cancer Cardiovascular Center in particular What impact has the non-utilization of those facilities had on the state?
Now, so there are key areas that these hospitals were meant to handle, right? Now, maternal mortality in this country is very high, one of the highest in the world, I must tell you. Cancer cases are rising, particularly breast cancer, prostate cancer, cancers of solid organs, cervical cancers. And cancer services are difficult to actually assess because there are very few cancer centers all over the world. And in this country, there are very, very few. So when the government of Rivers State built that Sir Dr. Peter Odele Cardiovascular and Cancer Center, it was a thing of joy to everybody. Because one is going to bring access to cancer care closer to Rivers citizens. Two is going to help health workers in Rivers State have the knowledge that they probably would not have if the center wasn't in Port Harcourt, Because, experts will be working there and there'll be exchange of knowledge. Three is going to generate revenue to Rivers State. And then it will generate employment opportunities. So more doctors will be employed, nurses will be employed, other health workers will be employed, And many other secondary businesses that would spring up because of that hospital. But like you just read, this is 2 years down the line, the center remained closed, hasn't been able to treat a patient. And that, like we said, is a symbol of our collective waste, really, as a state.
There are always questions about how equipped a facility is locally to address whatever the problem is. And I know that many times, even here on radio, we ask people, if you had the option of leaving the country and getting healthcare here in Nigeria, if you could vouch for the quality, would you rather take it here? Of course, different people will answer differently. Based on what was on ground, was that facility equipped at the time of commissioning to treat and manage a cancer patient?
I can't tell you really. You can just go online, get to YouTube, and you'll see the equipment that are in that facility. World class, I must tell you. And we commend the government of Rivers State for that bold initiative because many states wouldn't take that. So fully built, fully equipped, and ready to go. So we think that the issues around why the center hasn't been opened are things that the government of the state can sit down and quickly resolve. So the center can be open to the public because there are patients that need those services. There are health workers that need to work there. There is a lot that the government of the state can make, and there's a lot of knowledge that can be learned from there. It will turn the state to become the health tourism destination in the country, I must tell you. And if you look around the Niger Delta region, you realize that there isn't any center as that center. So it's not just about Rivers State, it's about the entire region in the Niger Delta and perhaps the entire southern region of the country. So these are key benefits that we are missing out as a state when we continue to allow those two centers to remain closed up to now.
We've talked about brain drain a couple of times in our conversations. If those facilities were operational, would it in some way have had an impact on doctors who would maybe have wanted to leave the country to practice? Was it good enough to make somebody who would have left say, you know what, I can stay here and practice?
Absolutely. Now, let me tell you this. Oncology is one subspecialty that is attractive and many young doctors are beginning to consider going into. We have not very many oncologists in the region. So if that center was open, you realize that many of the young doctors who probably want to travel out to specialize in oncology would stay back, and learn. And the more things you know about what happens in your region, the more efficient you are as a doctor and the more useful you are to the system where you work. So first, brain drain would reduce. Young doctors who want to stay around. The next thing is that job opportunities will be there. The commonest cause of brain drain in our previous discussions is because there are no employment opportunities. And doctors that are employed they don't see any future, for career growth. So a center like this as world class would provide you that conducive work environment to work. And you're learning a lot, you're contributing a lot, you're seeing patients get better. And, as a doctor, what else do you need?
Yeah, with a facility like that, of course, the education of that particular, the treatment of that would have increased as well. Now, at this time, do we have the expertise for the facility, or would we have needed to import, whether from different states or outside the country?
So when facilities like these are being built, right, there are many ways they can be run. First, you can do a private-public partnership.
Okay.
So you can bring in experts from outside who come in and then train, health workers locally and transfer knowledge and expertise. And then they now take over after a while, and start managing the place. That's a good concept. You can decide to work with indigenous health workers, right? But for cancer treatment, you see, it's not, like I said, it's not an area where there are many doctors in. So for us, we would be very happy if the government brings in people from outside that can train health workers here, and then after a while, allow them to take over and to run the place.
Now, we've been talking about costs, and there are different kinds of costs to consider. There is operational cost, which is if it was running, it would have also cost something to keep it running.
That's right.
And there's the idle capacity cost, which is what's happening now. The fact that it's not working,
Absolutely.
It's also costing something.
That's right.
Now, depending on the industry, if something has been abandoned for a while, to get it to start might also cost something.
Absolutely.
Sometimes you say, some of these machines, if they were working for 4 years, they would have, so we might need to get new ones. I know that this is a bit technical and mechanical. If River State government says, okay, you know what, let's start using that now, do you think it might cost us something else to start the machine turning because we have abandoned it for a while? Or would we just hit the ground running with what we have there?
It definitely will cost the government something to get it started, but it won't cost them as much as it costed to construct the place. I mean,
Okay.
You mentioned how much it took the government to get the place built and equipped. It won't cost that much to get it started. But the flip side is that the moment it started, I can tell you that you make back all that you spent getting it started, getting it built, getting it equipped. Because cancer treatment is expensive everywhere.
Yeah.
And the moment you're able to provide the service, you attract patients from all over, to come here and receive services. And it's phenomenal what the health landscape in Rivers State will become, because people will just troop in and come and receive treatment. And our health workers will be happy because they're learning a lot, they're seeing a lot of things, And then you can just imagine many other things that will just crop up because the centers are open and they're in use.
At least taking away the money for flight alone is something.
That's right.
All right, we have many more questions for Dr. Diamond, but we'd like to hear from you. 0817-923-0002. It's costing the River State government a lot. The 2 world-class facilities have been non-operational for around 4 years. My question is, do you have any health facility in your community that has remained unused? And would you trust a government hospital for serious treatment if they are equipped to handle it or prefer care abroad? 0817-923-0002. 0817-923-0003. WhatsApp is 080-903-06-416. We're live on Facebook, Twitter, YouTube at Nigeria Info PH. You can watch, listen, and engage. Please turn off your radio as you call. It's very important. Hello, good evening.
Yeah, good evening.
Good evening. What's your name? All right, go ahead.
Yes, sorry. I heard what is going on, and I begin to think in my mind.
Please, can you speak up?
This hospital not open.
Hello?
Because why was this hospital not open, commissioned for use? Is it political or engineering-wise or what? Because this time that people are looking for way to treatment here and there. Because the hospital will be open. I tell you, even with hotel facilities in this state, we make a lot of money. Our airport will be busy. Our parks will be busy. I think we need to look at the problem we have in this state. If it is political, I'm suspecting that. But I want to hear, when was this hospital opened?
Okay, thank you for that. Well, there have been a few reasons stated, but let me run through this very quickly before the break. Back in March 2024, the then Commissioner for Health, Dr. Adezore, blamed the delay on the withdrawal of the private partners meant to run the facilities. In January of this year, she again stated that the hospitals were not yet operational, but would open soon. In June, the state sole administrator, Ibokete Ibas, visited both sites, but no further update has been given since. So it is seemingly political, but the only statement that kind of makes sense here is that private partners withdrew. After the break, Dr. Diamond and I will talk about that, and we obviously have more questions that require answers. Please stay with us. medical expert, Dr. Tamunokuro, and the chairman of the NMA River State chapter, Dr. Tamunokuro, and he's right here in the studio with me. We're talking about the facilities, two in particular that are the case study, that have been built for over 3 years, commissioned, but not put to use. Now, one of the questions I asked before the break, and that's for you, the listener, do you know any health facility in your community that has remained unused? Because we are certain it's not just the two. Remember, we're live on Facebook, Twitter, YouTube, at Nigeria Info PH. You can watch, listen, engage. A comment on YouTube reads from Tambari Birane. Those are not the only health facilities that have been commissioned but not in use. The Zonal Hospital Bori that was commissioned earlier this year is not in use. There are overgrown grasses on that premises. Wastage, he says. Francis Obinna says, thank you for bringing this up. Sam, this is what we should be talking about. And Francis Obinna again says, also include the veterinary clinic at Rumodumaya, which is under lock and key. I'll take a call or two and get back to my guest. And the question remains, do you know any health facility in your community that has remained unused? Well, also, would you trust a government hospital for serious treatment or prefer care abroad? 0817 923 0002. 0817 923 0003. WhatsApp is 080 903 06416. Now, over to you, Dr. Diamond. I'm certain there are other facilities across the state that, just like the two we mentioned.
There may be, and we just heard two from two of our listeners. As long as the health facility remains closed, it's not good business for the people that are supposed to be served by the facility. It's not good business for the government. It's not good business for the health workers at all. There are not even enough health facilities for river citizens. So every facility around us should be open, operational, and should be in use. There may be issues, that will require attention of government, of the people that run or manage the facilities. But those issues shouldn't amount to a health facility being closed. I tell you, Sam, even at war times, health facilities are not closed. They are open. Yeah. Because people have to be attended to.
Yeah, they're needed desperately at that time. Okay. Hello, good evening. Hello.
Hello.
Good evening.
Good evening, Tamunokuro.
Evening. What's your name?
This is Jackson Afios.
All right. Where are you calling from?
Calling from Auda.
Please go ahead.
It's only in this country or in this state that a facility will be commissioned and not being functional. Under our watch, when the former governor was in seat, the River State Transport Company bus terminal was not functional. It was closed. Throughout his tenure, that place was not functioning. It was one Cobra came in that he reopened the place. But today, in Abuja, state-of-the-art bus terminal was built. More than 1, 2, 3. If it is his personal business, can he build it like the hypercity that was spread over Port Harcourt? It was built and it was functioning today. There's such facility, the health, that is very, very important, was not functioning. It wasn't functioning. When they have health issues, they fly abroad. That is the political elite. That's why the average people or the common people, as they always put it, they have nowhere to go. So many persons die of ailments that could have been treated in the country. But because of the way our leaders behave, nothing is functioning. Let them change their attitudes. Thank you.
Right. Oh, thank you very much, Jackson. Your point has been noted. But if you cannot substantiate that the former governor owns the supermarket you mentioned, then be very careful about how you spread that piece of information. Good evening, presenter. My name is Jesse Akayogo from Gwara community. The community health center in my community, Gwara community in Kana, is nothing to write home about. It has been abandoned because there's no staff and the facility is in bad state. Thank you. The general hospital in Ubima is overgrown with grasses. Okay. My own community health facility is useless. We need a good one from government in Opiro Eche. That's from Excellency Wala. I'll get back to those messages shortly. Now, let's look at what the former commissioner said, Dr. Diamond. Adeziore blamed the delay on the withdrawal of private partners meant to run the facilities. If we are to go with her position, now, how do I ask this question now? In the event that private partners withdraw, what is supposed to be the backup plan, right? Because, like you've mentioned and I said, healthcare is essential. So where we can't get partners or sponsors or whatever they may be in whatever capacity, what is supposed to be the plan to ensure that such a facility keeps running?
We are not speaking for government. I think government will speak for itself.
Yeah.
But like you ask, if there was an agreement and one party fails or for some reason the agreement couldn't proceed, I think the best thing is for us to sit back on the table of discussion and then find a way around the agreement. I think, like you said, we should look at value in various ways. First, there's value to the public. The public shouldn't be bothered about the agreements between parties when it comes to healthcare. So we should look at the overall value that these health facilities provide for members of the public, and any such agreement can be reached, and any other party can be brought on board. So that facilities are open. Is these two key facilities that a lot have been spent. The Mother and Child was opened it was commissioned in 2021. This is 4 years down the line. The other is close to 2 years now, and the kind of services that we miss as Rivers people is what is a problem to all of us, and we feel that the time to act really is now. Okay.
That question feels like a part one of what I want to ask, because a lot of times continuity is not political culture. This governor comes, does his own. The next one, if they are not in good terms, does not consolidate on the project of the other one, or even decides to do whatever he wants to. So, when we have a system where governance is continuous, but governments come and go, how can we ensure? I'm certain there has to be a framework, a blueprint to ensure that healthcare service does not stop. Because right now, in this case, that facility was built by a former governor. Now we have another one, even though we are in an emergency rule and we're still having conversations about the closure. Another governor will come. So is there a fallback plan that healthcare has to ensure that politics does not interfere with healthcare, which is essential?
So those of us that are professionals, we don't want to, speak a lot about politics because it's not what we're here for, really.
Yeah.
But to answer your question straight, the ability to question government to do the right thing, particularly with respect to health, lies in the people. And this is where I think that the people of Rivers State would need to ask these questions. We have seen these facilities. We know the value to create to us. Why are they not open? And I think that's our concern primarily as professionals, not the political side of it. We have no interest, zero interest in it. But the opening of these facilities and the kind of services that it will provide, particularly our interest is the employment opportunities it provides to health workers in the River State, and the revenue that the state can gain from it. It's interest for all of us. And we feel that if these facilities are open, everybody will be happy for it. Like you said, traveling out to go and receive treatment, it's you're going to spend so much to receive treatment.
Yeah.
And the stress of transporting a cancer patient from here to places in Abuja and Lagos and Ibadan to receive radiotherapy and chemotherapy and all that when it's available within your state. It becomes difficult to imagine why you should be referring patients out of the state when you should actually send them to somewhere close by where they can have this treatment.
Okay. And back to you. Do you know any health facility in your community that has remained unused? Would you trust a government hospital for serious treatment or prefer care abroad? These are the questions begging answers. 0817-923-0002, 0817-923-0003. WhatsApp is 080-903-06416. Please turn off your radio as you call. Hello, good evening.
Tamunokuro.
Good evening. What's your name?
Yeah, my name is Comrade Clinton from Bori.
All right, go ahead, Comrade Clinton.
Yeah, this particular trend of building structures and abandoning them is rather very unfortunate and should be stopped. If you come to Rogoni land here, there are a lot of abandoned facilities. In Taba, some health centers were abandoned, and go their bushes are growing there. These are facilities that were built with taxpayers' money. If you come to Bori here, the one that was built recently have not been furnished. Grasses have grown there. And I wonder what we are doing. These are monies that we have used in constructing this particular structure. And if they can actually furnish it for the people to use, it actually generates funds for the government. But I don't know this trend that we're embarking on. It's not helping us in this state. Please, let's revisit these centers and reach them for use, for the public to use them. Thank you.
Thank you very much, Clinton. Hekume from Omerelu. Am I pronouncing that correctly?
Yes, Hekume Anyawa from Omerelu.
Okay, welcome.
Yes. I want to speak as regards to the abandonment of most of the health facilities around the state. Like the one at Isiokpo, that is General Hospital at Isiokpo. A situation where government will build facilities. And some health workers will turn the area to a farmland where you see them planting series of crops, not even making use of the medical facilities any longer. So what I'm saying, as the doctor in your studio, as a young medical doctor and heading a professional organization, what is their effort to collaborate with government to see that these health workers are advised and these health facilities are working properly, giving direct advice to their colleagues, being commissioners and permanent secretaries in these ministries?
Okay. Hekume, hold on. Before you go, now these people planting these things, are they doing it because the facility has been abandoned, or they were doing it before it was abandoned?
That is what I said. Yes.
Okay. So because of the abandonment. All right. Please hold on to that question. Dr. Diamond. Caption from HA. Good evening.
I think it's even better, caption.
Yes. Go ahead.
It's even better questions are being asked. Because sometimes even the host communities support this abandonment. Because when issue of Songhai farms came on board, the people supported it. When they were asked, are you monkey that eat banana? They said no. And that project, one thing leads to another. If you go to all the health centers built by the previous government, they are all abandoned everywhere. In fact, it makes it worse that even in Chokotaya where I live, we don't even have one. If you can imagine where that I was about to save a soul, a child was dying, and I intend to take that mother to the child to the hospital, and incidentally the child died, and I was meant to, that hospital doesn't work every day; it works only on Monday. I wonder why government speaks about health, education, and agriculture. Now, what we hear today is project commissioning and the rest of them. Let those people continue to ask questions. Why all these things? If you go to, when I passing through this mother and child hospital, it bothers my mind that even doctors' quarters, even nurses' quarters or whatever, we are all built. And today we cannot make use of that facility. And the doctors and the rest of the stakeholders should continue to act so that government will deem it necessary to put all this in because health is very important.
Okay, Caption, thank you. But before you go, why will a community be happy that a health facility is abandoned when it's supposed to provide healthcare to them?
I can't get you well.
You started by saying that some communities encourage it and they are happy that these facilities are abandoned. So I'm asking you, why will a community be happy that a health facility is abandoned when it's supposed to provide healthcare service to them?
Do you know why I tell you that I said communities are happy? It started by when the Songhai farms, the governor went there and told them that, are you monkey that eat banana? They all said no, and that was end of Songhai farms. So if it could be done to such a huge facility like Songhai farms, then tell me about just a near health center that is situated within your neighborhood.
Well, I understand, Caption, but I doubt that that's enough, right? I doubt that that one statement, that call and response would have been enough to abandon that facility. I'm certain that there are many other issues beyond the question and the answer giving on the spot. Peter from Ahoda. All right, call back if you can. Weber from Ahoda.
This is Weber from Ahoda.
Yes, Weber. Thank you for joining us.
Yes. I'm speaking, although Ahoda, Olapata is inside Ahoda East. Yes, there's a health center in my village, Ahoda. Olapata abandoned completely.
Okay.
Built by Rotimi Amity's administration. Get to there now. Amity Commission did that, equipped it all round. But during weekend power time, I don't know what happened. Today, some part of it is derooted. I just wonder, what kind of country state are we living in? Tomorrow, the rich ones will move to get treatment somewhere outside. So that is for the information of the state now.
Okay.
Where do we go from here?
Thank you very much, Weber. Yes, indeed it is. I'm trying to do justice to as many messages as I can. Greetings, presenter. Yes, there's a junior secondary school built by Amechi administration in Olwa, Rumodogo 2, Town Odego. Till date is not functioning. Honorable ASBK. Okay, thank you for that. But I'm sure that I was particular about health facility. Do you know any health facility in your community that has remained unused? This is a school. It's also a project, but we're talking about health. Evening, presenter. The Buguma General Hospital is one that has also remained unused, except the mortuary. Why should it be so? Emmanuel from Port Harcourt says, okay. Well, Dr. Diamond, we've had callers express their different views. We have just 5 minutes on the clock. Speaking about... somebody asked a question. Yes, the enemy, and you know what the enemy is doing.
That's right.
Yeah.
Well, I think that when you talk about abandoning projects, health facilities generally, first, I don't know of any community that would intentionally ask that their health facility around them will be abandoned. I mean, that's really absurd. But the key factors here, to our mind and from what we have seen, number one is insecurity.
Okay.
When an area becomes insecure, there is no health worker that can stay there. Nurses, doctors, every person will just leave. So the communities have more work to do in owning these facilities and making sure that the place is safe for health workers to come in. I mean, that's basic. It's key. Number two is accessibility. And that's where politics comes in. When you cite a health facility far away from where people live, there is no way you expect them to utilize that facility. I mean, many times you see politicians tell government, cite it here because this is our family land. Whereas your family land is far away from where the people actually live. So that's one of that factor. So you realize some of those facilities are far away from where people live, and there are issues of insecurity. Then the deficits in workforce. If you don't have enough doctors covering all the facilities, you realize one or two would have to suffer for that deficit. So those are the key things we have found out. For us as NMA, it is clear if a doctor is not visiting a facility when he's supposed to be working there, we frown at it very seriously. And we have an internal mechanism of dealing with that. We must make sure that person is sent to the disciplinary panel and he faces it thoroughly. So that's key for us. But for the communities, I think that they need to own the health facilities and see how it becomes more peaceful for people to walk in. But the two key factors we are talking about here, the two key facilities here have no security issues. So they need to be open for the public to utilize them.
Now, finally, Dr. Diamond, the functionality of these facilities, will it rekindle hope and faith in our system? We recently heard that yet another top government official has gone abroad for treatment, and this has become the culture of our own leaders. Nigerians who can afford medical tourism would, of course, want to spend their money. But if these facilities work, would the average Nigerian be trusting enough to want to use it, right? If I can afford to go out and there's cancer cardiovascular here, now it's up to me to decide which one I want to. But because there's a Nigerian way of doing things, there's Nigerian factor, we don't trust our... Do you see us coming to a point where we now have faith in our own?
So there are two groups of Nigerians when it comes to affordability. There is the group that can afford treatment and they are willing to access that treatment anywhere it is. There is the group that would want to access treatment because they would gain some more from government if they go farther away from where they live. The first group would utilize the services anywhere it is. If it's in Rivers State, in Port Harcourt, as long as the quality is okay, why not? The second group is looking for what will get into their pocket, not actually the quality of service. So when they go farther away, they gain more. So you realize that whether your service is good as the service outside, they will still want to go outside.
Okay, hold on.
Mostly that group is people that are the politicians.
Okay, now I get it. If you didn't end it like that, I would have wondered how I'm getting more by going outside. So politicians, okay, I get it. So if we start to work, then our people would work as well. Let me put it like that.
Absolutely.
Thank you, Dr. Diamond. It's always wonderful doing this with you. We appreciate your time and your resource. Have a wonderful day, sir.
Thank you very much, sir.
All right. The major news comes up at 6. After that, it's open season. Stay with us.